coming at you from what I call America, new and improved. We are trying to, we're in a new place and it's kind of exciting. And so I'm grateful to have this chance to even present to you virtually today. What I thought I would do is share some opening thoughts about collective impact and my experience. In front of me, and it was interesting reading about your work. I'd share just a couple reflections, and to me, the three things that I think I've learned most about collective impact are: one is that the clearer, more precise, and rigorous the strategy is, the easier it is to do all of collective impact. The more vague the strategy is, the harder it is to do. The second is that culture eats strategy for breakfast, that you can build a great strategy, get people engaged, but if you don't create a culture that supports inclusion, accountability, ownership, trust, if you don't build that culture, the strategy is not going to work. And the last thing, and this is the thing I find myself dealing with a lot with collective impacts, is that the form of collective impact, the way it's organized, will follow the function, what the strategies and work are. And too often what I see is collective impacts building themselves based on a formula instead of based on what it takes to achieve their strategy. And so let me explain a little bit about what that means. And I want to talk first about strategy and having looked at that. I mean, first is that you've got these elements which are often seen as part of collective impact. The way that I look at them is that the common agenda is really your strategy. The shared measurement is how you track what you're doing on strategy. What's often called mutually reinforcing, I called it aligned action. You're just trying to get everybody aligned to do the right work that moves the strategy together across organizations. And what they call communication, I call engagement, because it's really about relationships and how you maintain relationships and trust and support across the network. You've got the backbone staff, but you have to have leadership culture. And I'll talk more about that a little later. Let me talk about the common agenda and the way that I tend to look at strategy and common agenda and collective impact. The way most organizations and efforts build their strategies is that people build programs to achieve outcomes, often based on some research that those outcomes are useful and that are aimed at some type of population change they're trying to reach. So if we're trying to make sure that more children graduate from high school, we develop a program that works with kids who are teens to help them build skills to stay in school so they'll graduate from high school. And our hope, and we know that there's other programs doing similar work with other kids. And the hope is if we add up all of our work, that voila, we'll have some magic impact on the population change. The problem is that often doesn't happen. The way that I kind of fell into collective impact was with an insight that hit me one day in April of 2010. That morning, the headline in my local newspaper was that my city had the worst third grade reading scores for African-American children in the country. That afternoon, I got a newsletter from the largest youth organization boasting about all the outcomes it was achieving with the 15,000 children they serve. And that disconnect really hit me. If you're achieving all these outcomes with all these kids, how is the number for the whole community never changing? And to me, what my journey to collective impact has been about is trying to understand that distance between the population level change we're seeking and the programs that are doing good work that's not adding up. The way that I typically look at a common agenda is using a result-based strategy, which first asks, what's the clear result? Who's the population who will benefit from the result, and what's the indicator we'll use to measure success? So if I'm building a program that's focused on reducing infant mortality, babies dying, I say, okay, our goal, our result is to reduce infant mortality. Our population is just within the city of Milwaukee, let's say, and the indicator will be the infant mortality rate for the city. Then and I have to be really clear on who will benefit. And so I'm going to set a goal of doing this within 10 years. That's my when. And we'll get into the how, but the who will benefit is going to be focused primarily, which is the population analysis, is that in my city, the infant mortality rate is 2.5 times higher for African American women than white women. And it's also highest in 6 zip codes, where there are 14,000 women of childbearing age and about 800 live births a year. So with that knowledge of the data, I can say, okay, so the population, I want to focus on a city of 600,000 people. My target within that is going to be these 14,000 women in 6 zip codes and these 800 live births a year. What are the factors that support or impede the result? We brainstormed what are the factors that influence a baby blowing out their first birthday candle. And we came up with a list, and then we had to look and say, okay, let's test this out. Let's look at research. Let's talk to other leaders and experts and community members and really test out these, because one of the things we found when we looked at the data was that 60% of the infant mortality was a result of premature births. About 25% was a result of birth defects, and about 15% happened in the home. But at that point, if you looked at most of the programs that were working on this issue, almost all of it was focused on safe sleep and factors in the home, even though the home was only 15% of the problem. So we had to really understand the factors and understand what drives the prematurity rate, which seems to be the leading indicator. We learned things like birth spacing and intended pregnancy and prenatal care and a bunch of other things. Then we have to understand which of those factors we've identified could we have the most influence over, and which of those factors would have the most influence on the impact we're seeking. And through that, we identify what are the strategies that are going to have the best chance for us of achieving change. And then for every strategy, we have to have performance measures. How much of that strategy do we need? Are we going to do that for 50 people or 500 people? How will we know it's working well? What are the quality measures that will tell us it's working? And how will we know it's contributing to our ultimate result? And so that's what we have to evaluate. And then finally, we have to understand who's all needed to implement the strategies. And this again is where I say that form follows function. The group we start the process with might not be the group we end the process with, because once we're clear on what the strategies are, we start to think differently about who needs to be at our table. So I'm working with a community that has a big focus on early childhood education. And as they're working on early childhood education, one of the challenges is that it's in an immigrant community where people are very don't trust the systems that provide early childhood education. And this group is trying to increase enrollment in those centers. The group that started the process was primarily people who were educators and leaders of early childhood education organizations. That made sense. But their problem is getting people to trust the system, which means the people they need to have around their table are people who have trust and relationships with the people they're seeking to get in those seats. And so the work groups and tables they create are going to change as they look at their strategies, because they realize that the people they need are going to have to be people of greater trust. And so to me, the form, the who, follows the what. And just to show you a couple examples of this, this is in a region in California where they're very much focused. It's an area that has both extreme, like much of America, but even more extreme in this case, it has extreme wealth. It has communities that are some of the wealthiest in the US, and it's surrounded by farmland that is primarily farmed by migrant farm workers, primarily from Mexico and Latin America. They have a massive problem in affordable housing because there's so much wealth there and it's such a great destination. And so what they identified their who, which is households that pay more than 30% of their income on rent. They decided and they found out that 55% of their households are rent burdened. And that's 60,000 households. That's 32,000 households. Their goal is to affect 40,000 people, which would be about almost 10,000 households. And so their goal is to build at least 1,000 new units of affordable housing a year, build a regional housing fund to invest in community value development. Community value means that it's housing that's informed by the residents, and to engage residents to drive our collaborative work by creating policy changes and helping advocate for policy changes that will support their lives. And the way their structure is set up is they have a steering committee, they have their backbone staff, and they have a resident table that makes sure that resident voice is central to their work. They have a community action network focused on housing, and they have a community action network focused on economic mobility. And then they have the backbone staff and consultants doing the functional work, and a long list of organizations at their table. Another example comes from another city that's doing education. In this case, they've built a larger initiative that focuses on 4 goals within education: early childhood, 3rd grade reading and math, college and career readiness, and post-secondary success. They have action teams focused on all 4. They also have teams focused on system and policy change. They have a funders table, they have a data evaluation table, and they also have a communications and narrative table. So it's a much bigger collective impact in terms of the function, but that's because they're going after 4 different results. For their college and career ready result, their goal is to double the number of high school graduates who are college and career ready. They have a state standard for that. Right now, 37% of high school graduates are career ready. Their goal is to move that to 74% by 2030. What that means is growing from 1,100 to 2,200 kids a year achieving that outcome, and to eliminate the racial disparity, because right now African American children achieve that less than white children. They've identified 4 strategies to move kids to achieve the college and career readiness score. And again, those are specific, they're numerical, and they're clear. And even if we take another level, for each of the strategies, we have a how much, a how well, and what difference made. And I share all that to just kind of frame this a little bit, because I think that a lot of efforts, how do I go back to, whoops. A lot of efforts that I see, as I said, starting on strategy. I think the clearer the strategy is, the easier it is to get people to your table, the easier it is to keep people at the table, the easier it is for partners to know when they go back to their agencies, what are they supposed to do, the easier it is for people to share progress and data. And so to me, it all begins with that clear strategy. And then the form of the collective impact has to follow from what the strategy is. And then you have to build a culture, and I can talk more about culture later, in terms of how do you create a culture that supports that both inclusion and trust, but also that accountability, that people make commitments and follow up on commitments in the work. So let me stop there, because that was a bunch, but I wanted to kind of take the strategy piece and start there. And then we can kind of follow from your questions, which I did review, and I did review also the background on the 4 activities that you're focusing on in the regional learning network. So let me stop there. That was a bunch, and I talked for over 10 minutes. So let me give you a little time to ask any questions. when leading a collective impact initiative. And as I said, it's clear results and strategies, an intentional culture, and making sure that the form follows the function and not the function following the form. You don't choose work because of the people at the table. You choose the right work and then get the right people around the table. There was a question about leading others and leading oneself, and what do you take responsibility for? And I wasn't fully clear on that, but the way I interpreted that question was somewhat about holding people accountable. That the way I look at leadership is that leadership is an act, not a position. It's a verb. It's something you do. It's not a position or title you have. It's what you do. And the act of leadership is taking responsibility. It's deciding I'm going to get something done and being able to work with people to get it done. And so to me, the act of leading in collective impact is that act of, it takes multiple contributions to achieve our ultimate result. And my responsibility is for the contributions I've committed to that will help make that result. To lead for myself, I have to make sure that I'm fulfilling my commitments to the collective in terms of the work and in terms of my participation. In terms of when others might not be fulfilling those same responsibilities, what I find is having clear roles and responsibilities that are created by that group, that are agreed to by the group, and that are kept in front of the group. We often put them on on flip chart paper that stays on the wall, or we put them on the back of the agenda, and we use them actively to manage the group. We say, listen, everyone here committed that at the end of every meeting, everyone would make action commitments, and I'm not hearing any action commitments. We've all committed to this, and using it as a way to manage the group. And if people aren't committed, then the question is, do they keep a seat at the table? And we have to be willing to kind of consider how people come and go from collective impact. And the space for continuous learning was the third question. And just quickly, I think that if you have clear strategies and you're measuring your progress, that ideally the work of the work groups is to not share information about what we're doing, but to look at the data, look at the progress we're making, and ask the question, what do we need to adapt or do to adjust to make sure we're moving in the right direction? So a teen pregnancy initiative here, what was happening is that the numbers were going well, but they noticed, because they also disaggregated the data to look at different populations, that the African American and white populations were numbers were starting to go down, but the Hispanic or Latino populations were not. And so then they adjusted their strategy. They created a task force in that community, developed new strategies and effort to address the issue in that community, and then tested those to see how they worked. And that's where the learning happens. It's that we use the data to adjust our work to figure out, like, boy, we're doing this, but we're not seeing change. What else do we need to be doing? And so that's where it happens. I wanted to show this example because one of the things that people in my community have been kind of blown away by is our county created a dashboard on COVID in our community, in my county. And to put it in perspective, my county has about 1 million people. So almost 100,000 people have had COVID in my county. But we can look at any point, and every citizen has access to this, and all organizations and decision makers. Oops. It's just really slow, but we can see the 7-day average, and we can see right now that it's been staying very low for the last several weeks, the lowest it's been actually since the beginning of the crisis. But when the spike was happening, we can see it. We could also see, hold on, I can see within my county the race and ethnicity of cases. And I can see early on we knew that the Black and Hispanic cases were far higher than the white cases, and we had to address that. We had, and this dashboard in this case by our county is updated every single day. But we also can look at the vaccinations here. And right now, our county has administered 270,000 doses. This is the 7-day average on dosage. But here again, we can look and see that if you remember where the Black population was in terms of cases, it was almost half the total white cases. But on vaccinations, it's far lower. So what did our county do this week? It prioritized anyone over 18 in 10 zip codes, which are the ones that are the least immunized. These zip codes right here, they opened walk-in clinics throughout these neighborhoods with the one-shot Johnson & Johnson vaccine because they're using this data, again, not like just to say report, but to look and say, okay, our Black and Hispanic numbers are not high enough. So we're going to prioritize these right now. While for the general population, you either have to right now be 65 years old and older, have a health condition that would complicate COVID, or have a frontline job. In these zip codes, anyone over 18 can get vaccinated regardless of any of those factors. And again, they've created walk-in clinics throughout these zip codes for this population. And that's because as they looked at the data, they were realizing that while doses are available to everybody, these populations have not been getting as much vaccine as the white population. And when they broke it down by zip code, they were able to see that they needed to get many more. And so the point is that there's the way to use this kind of information is not, again, as a as just a neat thing to like look at once in a while. It's so that you can look at the data and adjust your work as you go. And so our county has an emergency response program that's operating as a collective impact. And again, they look at that data and say, boy, we really need to focus. This data is telling us that there's a whole part of the community we need to focus our vaccinations in. And that's and that data is driving that. And that data also drove lots of decisions early on around COVID and around prevention as the death rate kept growing. Anyways, those kinds of dashboards are there's software that makes those far easier to create. That's a fairly complex one because it's looking at a lot of different data. But with the data the government's collecting and their willingness to share it publicly, it's enabling them and it's enabling community organizations to use that data in real time to guide decisions. And that's where the learning, and that's when they were looking and saying, we've been doing a marketing campaign, and our marketing campaign geared at African-American Latino population, but they're not coming in to get vaccinated. So we have to do something else. And they adjusted their strategy and decided to put walk-in clinics in the neighborhoods to administer the one-shot dose instead of the two, so people only have to come once. And so that's the way you kind of learn and adapt and use data in that process. The other thing I just want to kind of emphasize here is that data is information about people's lives. And in most collective impact efforts I've seen that are successful, they have people with lived experience or people who live in the communities served or others at the table, so we have their interpretation of the data as well, because the way they might interpret the data might be different than the way you interpret the data, and that's going to be important for solving problems. Anyways, that was a lot again, but I thought it was an example that might be useful. And again, happy to hear if there's any questions, or I can take some more from the document before. Management of the personnel. And here what I would just say is that in creating the common agenda, by having a table of people involved in the process who are diverse, who are trusted by different types of stakeholders, and who then feel a sense of ownership over the agenda, I'm much more willing to commit to something I had a hand in creating, or that someone I truly trust had a hand in creating. And so one of the things I often ask in collective impacts is, who do we need at the table to gain the trust of the people who are going to need to do the work? Because we can't always have everyone at the table. And so is there a community organization or leader or pastor or somebody who, if they were involved, there's a bunch of other people who'd see that person's involvement as a signal that it was a project or process they could trust? And how do we again make sure we bring those people in and have them in early so we can build that sense of ownership? There was a question kind of related, which is, what do you do with people who are opposed or not committed? And that's complicated, because if someone's opposed, you know, that becomes partly a political issue, not in a elections or government matter, but a small, what we call small p political, in trying to deal with what are the barriers that they're seeing. And sometimes we may make a decision that trying to truly understand what their barriers are makes sense, and that we might be able to build a bridge to where they're struggling. And to do that, we have to really go away from what they're, and really understand, what have they been observing about this? How are they interpreting what's going on? What are the barriers as they see them, and why do they see them that way? And really try to understand the roots of what they're looking at, because there may be misunderstanding at the root of it. There might be competition at the root of it, but understand what's at the root of that difference, and see if it's bridgeable. In some cases it isn't. Some people just don't want to participate or collaborate, and you can't get everybody. And sometimes you just have to make that choice and hope that if you're successful and you continue inviting and reaching out your hand, that eventually they might come in. And I think, again, if you keep a transparent process, a process that builds trust, a process that builds relationship, then that makes a big difference in people seeing that and seeing others they trust succeeding and being part of it, and seeing the process succeed. I know an initiative here that when the numbers at the population level really started to change, a lot more people wanted to be part of the coalition. And people like to be part of the winning team. And so those are some ways to address that. I think the one thing about, there was a bunch of questions around communication, and what I'll just add here is that everything's about relationships. And the more that people know each other and trust each other, things like communication, engagement, facilitation of meetings happens in a context where people have some sort of relationship with each other, that they know each other's motivations and backgrounds and why they do this work, that they know a little bit about what they do when they're not working, that we have ways to get to know each other as people, because we don't just collaborate as titles in organizations, we collaborate as individuals. And the more we can build trust and relationships as people, the better meeting facilitation works, the better communication works. If I feel a sense of connection with the people doing the work, it supports my ability to communicate and everything else. That's why I call it continuous engagement versus continuous communication, because it's not just about getting information out to people, it's about a way of people feeling connected. And when people feel connected to each other in the work, that supports, and communication then becomes just one of many means to support that engagement and connection to the work, and builds on top of that. And so that to me is a really important part of the collective impact culture is building relationships in order to build trust. And then things like facilitation and communication all happen on top of what already sits in a space of relationship and trust. I see we're coming to the top of the hour, so I just want to see if any of you have any additional questions, or Mario, or Anna, or Mika, if you have any additional questions that I can be helpful with today. I'm happy to answer anything live or as we close out our time together.